an NGO that uses debate as a tool to promote public speaking and critical thinking. And like, we're very firm believers that public discourse can solve a lot of problems. So if we talk about a lot of problems, we believe that they can be solved. We run regional and international programs. So in Rwanda, we have debate leagues, debate camps, and other various competitions, and international programs like the US Tour, the East African Debate League. But I won't get into much details for the sake of time. So you can visit our website. For those on YouTube, I'll put it in the description box. But for those that are here, it's debaterwanda.org. And before we begin, I would like to give the floor or the screen to our very own managing director, Jean-Michel, to give the opening remarks. So Jean-Michel, the floor is yours.
All right, thank you, Cynthia. Good evening, everyone. My name is Jean-Michel, and I'm very excited for this debate because I think this is the first debate for this academic year. And I would like to thank the Marian University debate team, most especially Drew. Thank you for helping us arrange for this event. I'd like to thank the debaters, Abigail and Ben. Thank you so much for allowing to have this event with us. And also, of course, our debaters on our side, Dani and Tiffen. Thank you for allowing to be part of this event. I'd like to say that the reason to why we began these events is we were all impacted by the pandemic that started last year in 2020. And one of the things that the pandemic did is that it limited our ability to travel, to be all in the same spaces, the same physical spaces. But this pandemic has also provided us with an opportunity to explore other ways that we can have conversations that are still important, conversations that affect everyone, whether in Indianapolis or all across the world in Kigali, Rwanda. As you would see, to have this event in all of us together would have costed thousands of dollars because we would have had to travel, take a lot of planes, and maybe sometimes, try different foods, try different things. But now we, through the wonders of the virtual world, are able to connect. And we believe that these conversations are very, very important. And tonight, we're going to have a very important debate, which is about vaccination. Who would have thought in the beginning of the year, just to remind each one of us, vaccines were not available. They were not available for anyone. But through the wonder of science, we have had these vaccines for the last eight months. And with that, access to vaccine has become a very important discussion all around the world because we have been able to see different issues that arose with that. But I think it provides us with an opportunity as members of the global community to have this interesting discussion and this interesting debate about whether or not it should be made mandatory or if we should wait for everyone to have access to them before we make them mandatory. I'm very excited for this debate. Thank you to everyone who's tuning in, whether on YouTube or here, and everyone who's going to see this debate afterwards. And I'd like to say to all our debaters, you are the champions. You are the ones who will make this conversation productive. And we can only be excited to hear all the great thoughts that you have and all the intellectual discussions that we're going to have. So thank you all very much. And I can't wait to hear what each side has to say about this important topic.
Thank you, Jean-Michel, for such a nice opening remark. If we could have the proposition side introduce themselves, the names, the school, what majors you're doing. Yeah.
Absolutely. My name is Ben Wilson. I am a senior at Marian University in Indianapolis, and I am double majoring in communication and religious education.
My name is Abigail Unruh, and I am a senior here at Marian University, and I am studying political science.
Um, Thank you very much. If you could have the opposition side introduce themselves.
Hi, my name is Kaliso Denis Fidel, and I'm a student. I'm still in high school. Yeah, my last year. Thank you.
Thank you very much, Danny. Tiffany is still trying to log in, but we're going to start the debate because she's the second speaker. So if we could have, the floor is open for the first speaker.
Alrighty. Can everybody hear me well?
Yeah, we can.
Alrighty then. I will, without further ado, get started then. Thank you everybody for coming out to this unique opportunity today. We are looking forward to have a healthy debate, certainly here today. Today's resolution is resolved. The COVID-19 vaccines should not be mandatory until it is universally accessible. We here at Marian University stand in firm affirmation of this resolution today. And to give you a quick roadmap of where we're going to go with this, I want to talk about some definitions, a weighing mechanism, and then go down to our 2 points. So first, some definitions. The first thing that we think we need to define here is the word mandatory. Mandatory is to make something required, and when you have a mandate and you make something mandatory, there are usually punitive measures to enforce that if someone does not comply. Next, we need to talk about what is universally accessible. Here, I'm actually going to borrow a page out of Universal Design's handbook here. When we make a building universally accessible, instead of putting the handicap ramp all the way over to the side, it's built into the design of the building and is meant to be used by everyone. In this case, a universally accessible COVID-19 vaccine is a vaccine that all people can take regardless of allergies, religious affiliation, or physical access in their geographic location. Next, I want to talk about a weighing mechanism. That's essentially how you as the audience determine who wins today's debate. Ultimately, there we should be talking about we should be weighing this on more true than false. Ultimately, based on the evidence we present in round, is what each side is saying is true, and whichever you determine to be true based on the evidence in round is the side that should win. Moving into my first contention, and that is that mandates require punitive enforcement. Currently, if a mandate were to go out today and that everyone should get the COVID-19 vaccine, we would have major problems. Problems such as, according to AP News from May 19th, a lack of access. Currently, right now, there are large vaccine deserts, meaning areas of the world in which there are little access to vaccines. As a matter of fact, only 2.3% of people in low-income countries have one dose of the COVID-19 vaccine. That's not from a lack of desiring to get it like it might be here in America, but rather a lack of access. They simply do not have the doses in their country or their immediate vicinity to get vaccinated. And so a mandate to them would be futile because they simply don't have the ability. However, another way in which a mandate would be futile is for those who are under 12 or allergic to the chemical components PEG or polysorbate, chemical components used in all COVID-19 vaccines that, if you are allergic to, can cause anaphylaxis upon injection. Therefore, we cannot require these people we cannot obviously mandate these people to go against their medically held against their medical allergies in order to get the vaccine. Before finally looking at how some members in religious communities are negating the vaccine due to its late-stage testing using aborted fetal cell lines. This was not necessary testing, and so in order to include them universally in the vaccine, we need a vaccine that did not use late-stage testing on these aborted fetal cell lines. It is possible to do. Moving into my second contention now, and that is that mandates, when broadly applied, create problems. According to the United States Center for Disease Control, individuals who are 65 years of age and older, or those who are immunocompromised, need the vaccines the most. This is because they are at greatest risk from dying if they contract COVID-19. In order to combat this, a generic blanket mandate that states that everyone should get vaccinated and get vaccinated right now would potentially see a world in which a healthy 20-something-year-old would get a vaccine before someone who needs it more, like like someone who is immunocompromised or over the age of 65. We need staggered mandates. This means that you would need you would need some kind of staggered mandate to do that, which ultimately means that if it's universally accessible, would be the best worldview in that case, because that would ensure that everyone has the best access to that. So ultimately, a responsible mandate would not punitively punish people for lack of access. However, a staggered mandate could drastically and negatively impact our world as well. And to demonstrate this, I'm actually going to talk about an extremely insignificant example, and that is in the National Basketball Association here in the United States. So, a player, Andrew Wiggins, who plays for the Golden State Warriors in San Francisco, will be missing over half of the season this year because he refuses to get vaccinated. And as a result, his salary will be cut, but ultimately he will be missing half of the basketball season. And it's all because of San Francisco's vaccine passport mandate that says in order to play in the NBA in San Francisco, you have to be vaccinated. So this is an extremely insignificant example when it really comes to the broader stage, but it does demonstrate one clear point. When you have weird blanket mandates where it's mandated in some cities or some countries or some states, some counties, etc., and not in others, you have situations where instead of Andrew Higgins playing basketball, you have truck drivers, cargo ship crews, or air travel pilots that do not have vaccines either because they are allergic, cannot religiously take one, or have a lack of access, being denied entry and thusly the goods that they are carrying into that country, and it will disrupt global supply chains even more than they already are. So vaccine passports would also negate a staggered mandate, which is why ultimately it is clear from this two-pronged approach here, not only because mandates would negatively impact already disadvantaged people, but also because a staggered mandate just quite frankly will not work, even though that's what we need. We should wait until vaccines are universally acceptable to mandate them.
Thank you, Drew, for such a nice first speech. I would like to welcome the first speaker from the opposition side. The floor is yours.
Yeah, thank you. My name is Dani, as I said, and I will be the first speaker for the opposition. And allow me to start. And all my refutation will be like in my speech. I'll go back to it as I go down into my speech. So I do agree with the definition of the keywords that were in the motion, and I'd like to say it. In 1901, a deadly smallpox epidemic tore throughout the Northeast, prompting the Boston and Cambridge boards of health to order the vaccination of all residents. But some refused to get a shot, claiming the vaccine order violated their personal liberties under the Constitution. One of those holdouts, a Swedish-born person named Henning Jacobson, took his anti-vaccine crusade all the way to the US Supreme Court. The nation's top justice issued landmark in 1905, ruling that they legitimized the government's authority to reasonably infringe upon the personal freedoms during a public health crisis by issuing a fine to those who refused a vaccination. As a negative side in the debate, we are advocating for the following position. COVID-19 vaccination should be made compulsory in all countries that have access to the vaccines, even if the vaccine is not universally available, meaning every country that has access to the vaccine, it should be made mandatory to take the vaccine, ladies and gentlemen. Now, mandatory vaccination policy does not necessarily mean holding an individual down and forcibly vaccinating them, but it also means attaching some costs for not being vaccinated. For example, not being able to have your job maybe in the health sector or any other sector, or not even being able to attend college just because you're not vaccinated, ladies and gentlemen. Now, for the pandemic to end, we need to make sacrifices for the greater good if you want to make the pandemic go away any sooner. And we can only accomplish that if all countries that have access to the COVID-19 vaccines made it mandatory for all citizens to take them. Now, in my speech, I'm going to do basically three things. Firstly, I'll show you how serious the problem is. Secondly, I'll show you the level of confidence that the vaccine is safe and effective. And thirdly, I'll show you the risks of not taking the COVID-19 vaccines. The first thing I'd like to say, I'd like you to note the fact that our mandate, once you're not within our mandate, once you're not vaccinated, you won't be able to access the following things. First of all, you can't be able to attend a university without the COVID-19 vaccination. Second of all, you can't attain a job in the health sector or any other job that requires meeting a lot of people without a COVID vaccination. But third of all, you can't be able to migrate from a country that has access to COVID-19 vaccines without taking the vaccine. And this is all for the greater good of the people and the community at large. Now, first of all, how serious is the problem? For example, sorry if my time is up, open your mic and then tell me. For example, in the United States, the highly transmissible Delta variety has driven a surge in the COVID-19 cases that peaked around mid-September before falling out to the current levels. About 117,625 cases per day, based on the 7 rolling average. The country has reported an average of more than 2,000 deaths per day over the past week, which represents about 60% of the peak in fatalities in January. And this is just one country, ladies and gentlemen. Now, the following includes countries with the highest COVID cases, and note that all these countries have access to the COVID vaccines. The first is the United States, with over 44 million cases, with now the deaths that are over 700 cases. Now, Brazil has over 21 million, the deaths are over 500,000. India has over 33 million cases and has the deaths equaling to over 400 million. Mexico has over 3 million and the deaths are over 200,000. And Russia has over 7 million and deaths are over 200,000, ladies and gentlemen. This is just to show you how serious the problem is in these countries that literally have the full access to these COVID-19 vaccines. I'd like to go to my second thing. What level of confidence is the vaccine? Now, note that no vaccine is 100% effective, and while the seasonal flu vaccine is only 45% effective, still it is estimated to prevent 130,000 flu deaths in the United States alone each year. The COVID-19 vaccine can protect the majority of the people from hospitalization and deaths, which is why as many doses need to be administered around the world as rapidly and equitable as possible. Clinical trials of the Pfizer, BioNTech, and Moderna vaccines found them to be 94 to 95% effective against all symptomatic COVID-19 diseases after the second dose. This does not mean that we'd expect 5 to 6 in every 100 people to develop the COVID-19, but it means that 94 to 95%, there's a 94 to 95% reduction in new cases of the disease among people who have been vaccinated compared to those that are not vaccinated. The third thing that I'll do in my speech is to show you what kind of risks do we have for those that are not taking the COVID-19 vaccines. The first thing is going to be the fact that there is going to be an increased number of cases of the COVID-19, and once this increased number of people that are getting infected with COVID-19 increases, it means a lot of people in hospitals. It means limited resources for hospitals to be able to attend to them. Now, this means people are going to be dying from there, which takes me to my next point, which is increased number of deaths due to the COVID-19, ladies and gentlemen. If countries are in a position where they cannot take care of all those people that are sick, where now some have to be treated at home. Now, this is a problem just because if we cannot protect them through our hospitals, then how are we going to expect them to survive without taking the vaccine, ladies and gentlemen? This is when a lot of people are going to be dying. Yes, we do admit that there is such a vaccine equity and the justice that has to come from the fact that rich countries hold on to vaccines while poor nations don't have access to it. But however, since we live in an imperfect world with haves and have-nots, this policy would be the closest policy that could fast forwarding overcoming the pandemic, ladies and gentlemen. Now, in our policy, we say, make vaccine mandatory to all countries with access to them, continue putting stopping measures such as wearing masks, sanitizing the hands, social distancing in all places with no vaccines until they become available. And ladies and gentlemen, I'm proud to say that by forcing rich and powerful nations to make the vaccinations mandatory, we can solve the problems through these big and powerful nations to all of these low-income countries that are also going to be able to start to receive the vaccines once they're fully accessible as the team proposition advocated for. Is my time up? Yeah, thank you.
Thank you so much, Danny. We're now going to have the course examination. It's going to be 4 minutes. So floor is open for cross-ex.
Can everyone hear me okay? Everyone able to
I can
hear
hear you.
Yes.
Thank you. Just a quick blanket of thank yous, everyone, for being here and for everyone listening, and especially to all the coaches and everyone involved to help set this up. We couldn't have done this without you guys, so thank you so much. So just as a quick roadmap, I'm going to go over the resolution. Oh, this is cross-ex. My bad. So one of my questions for you is that can people still get vaccinated even if there isn't a mandate?
Yes, they can be vaccinated.
Do you have a question for us?
Maybe I'll do it later after you're done with your questions.
All right, sure. Well, then if it's okay with you, I have another question as well. Should a healthy 20-year-old get a vaccine before an immunocompromised 65-plus-year-old?
I don't think that would be fair in a country that has full access to the vaccines. So it means if we're in a country like the United States that has access to these vaccines, why would you get to vaccinate? Why would you get to vaccinate? Get a 20-year-old who is healthy to vaccinate that person before someone who's very about 65 years of age. So I think in a country that has full access of the vaccine, like it's so good to have those old people vaccinated first.
Okay.
And with the mandate, that would be very applicable.
Okay, sure. So what about people that are allergic to these vaccinations, such as those who are allergic to PEG and poly? How would a mandate, to me, if you were really going to mandate this for everybody, you would need a universally accessible vaccine that doesn't use those chemicals.
Come again with your question, please.
Yeah, so how should we handle people who are allergic to chemical compounds like PEG and polysorbate that are in all of our current vaccines? Wouldn't a universally accessible vaccine be better for them so everyone can actually get vaccinated and not just those that aren't allergic to it or don't have objection to it?
Actually, think that if the people that have access to the vaccines and are not allergic or have no any problem with taking the vaccine, I think it's very good for them if they take it with our mandate. But then the fact that if we are not making it a mandate and people are only going to do it when they want, it's going to leave those people that are risk, all those people that are even allergic to them, more vulnerable. Because think of it in this kind of way: if I have a friend who is allergic to the vaccine and I can take the vaccine, but just because I don't want to, I don't take it, it means that person is going to stay vulnerable just because of the health of that person. He or she is not able to take it just because maybe he or she is allergic, and me who is not allergic, I can't take it just because I feel like I don't want to take it. So I think with our mandate, all those people that are not allergic or have no health issues, they should take the vaccines just to keep all the other people with such problems, those that are old, those that are vulnerable and cannot take the vaccines, to keep them at a healthy condition.
Sure. Did you have a question, or should we continue?
Yeah, I'll get to a question. Yeah, so when you talk about religious communities that are against these COVID-19 vaccinations, according to your side, would you wish for these religious communities not to take the vaccines just because of the personal sovereignty, but then leave them at risk of being infected with the COVID-19 virus?
Yeah, absolutely. So I think that the issue at hand there really comes down to an idea of religious freedom. We shouldn't be forcing anyone to violate their sincerely held religious convictions. And if they have a sincerely held religious conviction, and when it comes to the COVID-19 vaccine, those convictions are against that late stage testing use of that of the cell line from the aborted fetus back in the 70s. So that's where that conviction against the COVID-19 vaccine comes from. As I mentioned in my speech, that's not actually a necessary part of testing. It just made it easier. So that's why we should include those religious communities in a universally accessible vaccine that did not use testing on those using that cell, what they would see as a compromised cell line.
So are you saying when they're universally accessible, maybe these religious communities will also get vaccinated, or they would benefit from that?
Well, yeah, that's what I'm saying is if we're going to mandate, if we're right, like this is the thing. When you mandate something, you are saying that if you do not comply, there will be punitive consequences. So in this case where we have these sincerely held religious convictions, we would literally be punishing people for not taking something that violates some of their deepest held, sincerely held religious convictions just because we didn't have a vaccine that was universally accessible to them. That's what I'm saying. We need a vaccine that did not use late stage testing using aborted fetal cells for those religious communities so everybody can get vaccinated and we're not punishing people for having religious convictions.
Great. So when you give an example of that NBA player who is going to be missing half of the season just because he's not vaccinated, is that player is he against? Is his religion also against the taking the vaccine, or it's just a personal perspective where he thinks that I'm not going to take the vaccine, not because I'm allergic to it, or not because my religion does not require me to take it, or it's just a personal perspective?
Yeah. So the example of Andrew Wiggins.
I can take this.
Yeah.
One. So what is going on is that let's use Catholics, for example, because they're ones that are very against using aborted fetus cells. What's going on is that because it's being used in this, it is hurting their religious views so much. They are refusing it because it's against everything that they believe and could hurt their religious views. But if there was a vaccine, which currently there is not, if there was a vaccine that went along with their religious views, there's nothing going against that. So then they could and would be willing to get those vaccines.
Yeah. And I think we're almost out of time, but just a quick clarification here. In the case of Andrew Wiggins, it's a fairly limited example because it's not a religious objection. It's just a personal objection coming out of a place of privilege, unfortunately. But that point was more to demonstrate the negative impact of patchworked vaccine mandates.
Thanks. Thank you, everyone. If we could have, that was a very heated course X. If we could have the second speaker from the opposition side. The floor is yours.
Thank you so much. Thank you everyone for being here, and thank you for providing class today. It's been a great debate so far, and I can't wait to hear the second speech from the opposition. And thank you to all the coaches that are involved that have helped set this up. It's been a great pleasure to debate against international debate. We don't get to do this, so this is really cool and fun. So thank you. Just as a quick roadmap, I'm going to go over the resolution, and then I'm going to just go over some refutation to my opponent's case and then rebuild my own. But first, the resolution stands as the COVID-19 vaccines should not be mandatory until it is universally acceptable. The definitions have been agreed upon today. So first, my opponents had talked about how COVID vaccines are required for life. And while this is true, there are those who are allergic to the vaccine because of different ingredients that are in it. So for them, that doesn't mean life. That could possibly, quite frankly, kill them. So we can't mandate this vaccine in totally because it would kill them. Also, if we mandated it, as my partner had stated in our second contention, it would hurt those who are 65 years and older to be able to get the vaccine, because healthy 20-year-olds or just healthy people in general would be getting the vaccine before them because there's not enough vaccines out there for everyone to get at the same time. So we have to really make sure that those who need it most get it first, and a mandate would not allow for this. because it would be mandated for all instead of those who need it most. Their second argument was about how many cases there are, and they talked about the US 120,000 cases per day, and the United States does have accessibility to the vaccines. Yes, we have accessibility to the vaccines, but not everyone has accessibility to get to those vaccines. So for those who are impoverished in our country, they have no way to get to the doctor or to these different sites that have the vaccines. So how are they going to get there? We need to have a mandate. If we're going to do a mandate, we have to have some way to get these people to be able to get there, or we're just disenfranchising them, especially like those who are disabled who can't go places like this. We are disenfranchising them because they can't get places around. So that hurts them because they aren't able to get it, and then they will be punished for it. They're also talking about how no vaccine is 100% effective, but the vaccines that are currently out are 95% effective. So since it does have a high effectiveness rate, those who wish to get it can get the vaccine and then be safe. So it's only on the people who don't get a vaccine, it's on them if they get sick. So don't we have that choice to allow people to decide for themselves if they want to risk getting COVID-19 instead of trying to mandate them to get it just so that they're healthy? I think it should be in people's self-want to get the vaccine than forcing it upon them. Because if you willingly go into something, it is better for you than to be forced to do it. The negation has already laid out a world where there is those in countries without vaccine access. These are disadvantaged countries are barred from a worldwide trade and travel. This is coming from a place of privilege in which vaccine access is used as a pawn, which will only further disenfranchise poor countries. So as my partner had stated, that if there's someone who is unable to get vaccinated or they don't want to get vaccinated, it is not only hurting themselves, but also it's hurting trade because they are drivers and going to different countries to trade with these countries. And so it's hurting not only them, but also the economic world because they are being mandated to do it and they're not doing that mandation. So instead of forcing them to do something that they don't want, we should just be more open about it and get those who need to be vaccinated first. Allow people who want to be vaccinated to get vaccinated, and then also be working on a vaccine that would be inclusive to all persons, those who are allergic to the two chemicals that my opponent stated, but also those who are allergic to other things that are in these vaccines, but are being told that they should get it anyways and just risk anaphylactic shock. And so on and so forth. So because of all of these reasons, because in our world, we see that there are religious views and that there are people that are allergic to different things. So we cannot mandate out of good faith because we can't force religions to go against their religious views. We see that we should have a vote in the affirmation because we're upholding a world where people aren't forced to do something against their will.
Thank you very much for that second speech. If you could have to deliver the second speech on the opposition side.
Thank you. Thank you, ladies and gentlemen. I'm the second speaker from the opposition side. So my first speaker basically tackled how serious the problem is. That's the COVID-19, how serious it is, how much it's affecting us. Two, he showed us how the level of confidence that the vaccine he showed us the level of confidence that the vaccine is safe and effective and its importance of the as a vaccine in the status quo. And three, he showed the risks of not being vaccinated in this time. Ladies and gentlemen, me being the second speaker, I'll mainly be providing you with data and statistics that only serves to prove that making the vaccine mandatory to those who can actually access it is the best way to get rid of this pandemic crisis right now. Allow me to start with the fact that currently there are enough doses to get 41.3% of the global population vaccinated. And yet in the status quo, we actually have 34.4%, that is 3.6 billion of people who are vaccinated. This just serves to prove that the issue is not about it's not more or less about it being available as the opposition side is trying to make us believe, or it may be being maybe affecting people in a certain way and making them not want to go for the vaccine. Issue is about it's about the willingness. And ladies and gentlemen, we honestly believe that making the vaccine mandatory to those who can afford it is a good way, is a good incentive to making people go for the vaccine, because in the long run we all have something to win. Again, I would like to go to the fact that people should be able to make yes, you did talk about the personal sovereignty and what people do actually, like you said, the proposition side say that people should be able to make their own decisions, people should be able to decide on what is being done for them. But ladies and gentlemen, people should be able and willing to make sacrifices for the greater good in cases of crisis such as this one that we're experiencing in the status quo. Another highlight to support this is the fact that, as my first speaker evoked, currently the countries that are being struck hard by the pandemic are countries that actually do have high access to the vaccine. That is from the US to Germany. Ladies and gentlemen, now again I ask, is it about the accessibility? Is it about it being really universally available, or it's about the willingness of the people to actually do it? Ladies and gentlemen, I also have another question. In the status quo, are we really sure that the vaccine are ever going to be actually universally available? Ladies and gentlemen, the proposition side literally failed to show us when is that happening. Do you have the guarantee that is actually going to happen? Also, ladies and gentlemen, I would like to tackle yes, also, ladies and gentlemen, I would like to tackle the issue about what you said, about what the opposition side said about us going against the religious beliefs of our people and trying to go against it. Ladies and gentlemen, we're not going against the religious beliefs of our people, because in this status quo, we do agree that some people may not be willing and wanting to go for the vaccine right now, and we do give them time. But ladies and gentlemen, either in cases that actually require for them to actually get the vaccine, we do believe that they actually should get the vaccine at this particular time. Again, I would like to go through yes, I would also like to get through to another point, whereas we're actually having two kinds of vaccines. The one that literally demands only a single dose regimen, while others require a 2-dose regimen. Ladies and gentlemen, this ends up creating disorder. Like, how do we get it all fixed up in a way that is going to actually, at the end of the day, be universally available? And also, the business side has not clarified as to what they're proposing us to do. If they do not, they're literally telling us that we do not have to force people to go for the vaccines. Yet they're supposed to be saying that they're supposed to be saying that the mandatory that the vaccines should be mandatory. So that's literally them going against their own views, because they're saying that people should be able to make decisions. Well, mandatory is not really what it means, because at the end of the day, no matter the way we define mandatory, at the end of the day, we're literally forcing, in a way, people to take a decision just because they cannot access a certain thing. Ladies and gentlemen, I'd also like to tackle to come back to what the proposition side again talked about, that we also have to look at the issues of the fact that doing such a thing is going to in a way affect the economy and all that, and we do accept that fact, which is why we think that we're going to make it mandatory to those who can actually afford to get it. So now, ladies and gentlemen, closing up, I would like to say that the biggest harm to our point that the proposition side has came up with is that we're going against the personal sovereignty. But ladies and gentlemen, these great nations that we know as of now aren't these sacrifices what made them strong nations that they are today. Thank you, ladies and gentlemen. I rest my case.
Thank you, Tiffen. Now the speakers have talked about a lot of points, and we would like to open the floor to the audience. So for the next 10 minutes, send in your questions, unmute yourself. This cross-examination is dedicated to audience. You can ask the proposition side, you can ask the opposition side, you can give your opinion on what's being talked about. This is a time to shine. Feel free to unmute yourselves, or you can raise your hand and I will unmute you. Or leave your questions in the chat, it's okay too.
I can ask a question. This is a question to the opposition side. I think that the proposition gave quite a case about people who, two kind of people, those who have medical conditions, and then also those with religious beliefs or religious convictions. So in cases like those, are they going to be imposed to take the vaccines, or like what is going to be what's going to happen for those two specific groups?
Okay, thank you. First of all, for those that are allergic and cannot take the vaccines due to the health issues, I do really think that they would be exempted from the mandatory case of taking the vaccine, just because that once they take the vaccines, they are only going to be harmed by the vaccine. It won't be any good to them. But then for those that are religiously like, their religious communities require them not to take the vaccines. As an example that I give when I was studying my speech, when the smallpox came out in 1901, like I gave an example of this church leader who went against this, and they put some fines, and as the proposition side talked about in their speeches, with the mandate, it means that people get to impose some fines, and those religious communities that cannot really abide with the mandate to take the vaccines for their own well-being, I think they're going to be paying the fines. And what I can add is that the fact that for this pandemic to go away, we need all of us to make some sacrifices, and part of the sacrifices is being able to take the vaccines, however much your religious community does not require you to take one or is against taking one. Thank you.
Like to add anything onto Denny's answer?
What I would add on is that just like what my first speaker is saying, same way we're claiming that we want to really take care of the personal sovereignty of people and of the personal convictions of people, their religions, what they really believe in. I really believe that a sense of sacrifice should be here, because it is at the end of the day, it's an issue that the whole world is facing. So a sense of sacrifice should be here, because I think it's what got most nations where they are today. So yeah.
Adele, you wanted to say something?
Yeah, I wanted to add on, as the ones with religious beliefs that don't allow them to take the vaccine. I think they should be, if you're not taking the vaccine, because I believe the vaccine has something it does in our bodies that fights COVID, because it wouldn't be there to be useless. So I believe if you're not taking the vaccine, I believe you should not go to the hospital to get cured, saying that you have COVID. Yes, it's harsh, but then if you're not taking the measures they gave you, then I believe you should not also go to the hospital saying that I have COVID, or I feel like I have COVID, or I need to take a test, if you're not taking the vaccine. So I think that's what
I wanted to add.
Would the proposition have something to add on to like refute what Adolfo said?
Yeah, I think that well, I think that's an interesting point. But I think if we look back, that is to say that if you didn't take a vaccine, even if it was a religious exemption and not just a position of privilege to say that you didn't take the vaccine, the opposition has been talking about this kind of sense of sacrifice throughout their kind of speech and how we should have the sense of sacrifice. I think that goes both ways. I think that in order for us to be a better global community, we need things that are universally accessible. And one of those things needs to be a vaccine. We should not be ostracizing entire religious communities because of their sincerely held convictions. Instead, we should adapt to them. And like we both said throughout our entire speech, these religious communities, their issue is not with the vaccine as a whole. It was with this one particular use of late stage testing, which means that all we need to do is create a vaccine that didn't use that late stage testing and it wasn't necessary. And so that in this case, to bring the entire world along, which is necessary because you can mandate out privileged objections to the vaccine. But when you have a universally accessible vaccine that no one's allergic, that you have an option that people aren't allergic to, and you have an option that does not violate religious communities, you'll get better compliance with the mandate because people don't have an out. And when we talk about a sense of sacrifice, we should not be ostracizing entire groups of people because of their sincerely held religious beliefs. In a sense, we should sacrifice and realize that maybe it was our initial failing to develop those vaccines that did not include everybody initially. And we should reach out and care for those people with love. And just because they, I think it's one thing to not take a vaccine, but regardless, we should care for the sick, regardless of vaccination status.
And to kind of add on to that, some of these people who are not getting the vaccine because of religious mandates, you're either asking them in their belief system, the way that they're thinking, get a vaccine that could potentially send them to damnation in their religious beliefs, whereas all of eternity in their beliefs, or get a vaccine for a temporary time on earth. And that's what we're asking them to do if we mandated them to do this. And I, in good faith, cannot ask someone to, in their beliefs, damn themselves to hell because of a vaccine that we could have made a different way.
Yeah.
Thank you very much. Would anybody from Marian like to speak on any of the points that were raised? Anybody from the audience?
Sure, I'd love to jump in with a quick question for the affirmative side. But of course, I would love to hear points from the opposition side as well. But first, to the affirmative side, sticking to what you brought up as religious exemption, could you explain how religious exemption is not a point of personal privilege? I understand, and I think you make a pretty solid case how medical exemption is not personal privilege because that is out of somebody's control. Could you further clarify how religion is not a point of personal privilege?
Yeah, absolutely. So when we talk about something being a point of personal privilege, we're really talking about a world in where they are willingly choosing to not get a vaccine for particularly no good reason. As Abigail mentioned in her last little rebuttal there, in the minds of the people with these sincerely held religious convictions, you're asking them to choose between what they view as an evil, essentially, and their sincerely held religious convictions. It would be, I would say, equivalent to asking someone who keeps kosher laws to eat bacon, or halal dietary laws as well. I think that in this sense, these are not coming from a place of privilege, because they're not, you're completely making a judgment on someone's worldview. And I think that we need to be respectful of the worldviews that people hold. And like I said, like we've said throughout the entire debate, it is not that we are asking for something completely different. We're really not. We're just asking for, these religious communities are only objecting to this one part of how the vaccine was tested. So it's something that we honestly, if we were trying to design a universal vaccine, could have prevented in the first place.
Thank you very much. So the last question in the chat, Grace asked for the affirmation. Are there any vaccines being developed without any allergic ingredients?
So as of right now, the vaccines that are being developed still have many allergen ingredients in it, such as shellfish, and then the two ingredients that my partner had also listed out for us today, which were PEG and polysorbate. I'm so sorry if I mispronounced that.
That's right.
But those still are in all of the vaccines that are currently being developed, and many other different allergens for different vaccines, depending on which one you're looking at.
Yeah, the real problem with that is with the COVID-19 vaccines, because it was such a pressing issue, the government funded basically all of the research. And when those three vaccines came out, when the three big vaccines, I'll say, came out, there's a lot more than the big three, but in the United States here, everyone typically hears about the Pfizer, the Moderna, and the Johnson & Johnson vaccine. And those are the ones that are being broadly distributed. But there are a lot other options, but they do all contain some sort of PEG or polysorbate. When those vaccines were developed, the government just stopped funding new research. So no new research is being funded because it's being viewed as good enough. And unfortunately, we're leaving a large population behind because of that.
Thank you very much, everybody in the audience, everybody watching. If we could have the reply speech from the opposition, the closing speech. You have 3 minutes. Thank you.
Yeah, thank you. The motion of today was the COVID-19 vaccines should not be made mandatory until it's universally available. As the narrative in this debate, we were advocating for the fact that COVID-19 vaccination should be made compulsory in all those countries that have access to the vaccines, even if the vaccine is not available to everyone yet. Ladies and gentlemen, in my speech, I tried to show you how serious the problem was, trying to show you how big the numbers are of those that are dying, and we'll also try to show you the level of confidence that we had that these vaccines would clearly help people to keep them away from hospitals, to keep them away, to reduce the number of people that get infected per day, or those even that get to die. And we also showed you the risks that we have once the COVID-19 vaccines are not taken. One of the risks were increased number of cases of the COVID-19, where I talked about the fact that people get to increase, the number of cases increase, which is a problem now to the hospitals that are going to be caring for them. But also it is a problem just because countries are not being able to provide all the necessary means to a big number of people that get sick at the same time. And then I went to my next point of the risk, which was also the increased number of deaths due to the COVID-19 pandemic. And we did the COVID-19 virus, where we did show you that at least if the vaccine was able to be taken mandatory, like in a lot of countries that have access to them, these numbers would reduce, ladies and gentlemen. Now, the proposition in this debate tried to show us how we should make countries keep their people's sovereignty, where an individual has to choose whether or not he or she should take the vaccine. They talked about the religious communities and also those that are allergic. But we also tried to show you how those that are allergic are going to be exempted from the mandatory case of taking the vaccine. But also those people that are in the religious communities, we did suggest and that they would have fines to pay just because they did not take the mandatory vaccination policy. As an example that I gave in 1901, when the smallpox vaccination was being put into place, those that were against the mandatory vaccination policy, they were forced to take the vaccine, and once you would refuse that, you'd be in fact you'd pay a fine of $5. Yeah, and I do believe with all this, if a mandate like this would be put in place where a lot of people are mandated to take the vaccines were available, just because some people don't take them just because they literally don't want to, but then once it's a mandate and you were supposed to take them, we do believe that this is the best way to help us get out of this pandemic very soon. And people's sovereignty, we wouldn't have any problem with that, just because at all times within this pandemic, we are sacrificing because we've been passed through the lockdowns and a lot of things with the curfews. But then with this, I think this is the last result that will take us out of this pandemic. And if it's made mandatory, a lot of countries would survive from this. I mean, those countries that have the access to the COVID-19 vaccinations. And with that, the opposition, we are proud to say that this mandatory case would be the best thing to do at this moment.
Thank you very much, Dani. If we could have the closing speech for the affirmation.
Absolutely. Okay, I'll go ahead and start now. So thank you everybody for this amazing opportunity and this amazing international debate. This has been truly a great treat. So our resolution today was resolve the COVID-19 vaccine should not be mandatory until it is universally accessible. And so here's what I want to do for you, audience. I want to give you three big takeaways, three things that I think really outline how this debate has functioned today. Big takeaway number one, get vaccinated as you are able. As you are able, please get vaccinated. Obviously, asking people to get vaccinated and people getting vaccinated does not go against what we are saying. We want everybody to get vaccinated, but it is exactly because we want everybody to get vaccinated that we need a universal vaccine before we mandate and make punitive judgments against against people. Big takeaway number two, that is about a patchwork of mandates. And this is exactly the world that the negation has set up throughout this entire debate. They're like, yes, those countries that are able, that have the vaccines, they need to mandate them. Okay, so when we create a patchwork of vaccines, this is exactly what we were getting to in our second contention here, using the really broadly insignificant example of Andrew Wiggins, who was coming from a position of privilege, but it was to prove a larger point about exclusion, right? When we have these vaccine mandates in larger countries, the countries that are richer on the global stage and have the ability to have these vaccines available for distribution, and you have things like vaccine passports, you only disadvantage those countries, those poorer countries that don't have access to vaccines. As I mentioned at the top of the debate, only 2.3% of people in low income countries have at least one shot. So by having these kind of staggered mandates, by having this kind of patchwork, you disadvantage those people. Also, when you have a patchwork of vaccine mandates, it allows for these privileged exemptions to slip through the cracks. When you have a truly universal vaccine so that no one can not take the vaccine based on allergenic reasons or religious reasons, you have a world in which no one can object, and everybody gets a vaccine. Before finally looking at our third big takeaway here, and that is by designing a universal vaccine and getting everybody a universal vaccine, we are affirming the dignity of every single individual, regardless of what country they live in, regardless of whether or not their country has enough vaccines to distribute or they don't. We aren't disadvantaging people in poorer countries even more than they already are on the global stage. And that is why ultimately we should not be making things mandatory until something is universally designed for the entire world. That is how you really get the world back to normal.
Thank you very much. This was such a nice debate. Thank you to the proposition. Thank you, Abigail. Thank you, Ben. Thank you to the opposition, Dani and Louange. I would like to give the floor to Drew to give us the closing remarks, how he found the events. If there's anything he would like to comment on, this is your time.
Excellent. Thank you so much for the transfer, Cynthia. And shout out to you for an excellent job in moderating today's debate. We certainly couldn't have done it without you. Thank you so much to the opposition debaters from I Debate Rwanda. Oh my gosh. Strong organization, strong argumentation, very sharp perspectives as well. Thank you all so much, and we're excited to keep debating against you all a couple more times. So let's keep bringing the energy, and let's definitely keep working together. To leap off of the point that Jean-Michel was making in the beginning, where the pandemic hit all of us and turned everything that we were expecting a little upside down, as is reflected in this debate. You know, Marian University Speech and Debate was looking for different ways to get connected, to get involved, and to keep competing just like everybody else is in the world. And we are so grateful to be able to make the connection with you all. There's a saying that we have on our team: big and small, room for all. And that means, you know, quite a few different things. It's about, you know, shifting perspective. It is about inclusivity as well. And a part of that inclusivity that we try to hone in is that it's not about inviting people into all the little spaces and all the little boxes that we have, but rather trying to open ourselves up to make space for people from different places that say different things and have awesome ideas of their own. And so thank you all so much for helping to partner with us and lead us on that journey today. We're just so excited to do more of it. If you all are interested more in Marian University Speech and Debate, you can reach out to me, Drew Stewart, dstewart@marian.edu, or you can find us online by searching Marian University Speech and Debate on Facebook, Instagram, as well as YouTube. And you can go to any of those places, see more information about us. And if you go to YouTube, you'll even see some of our original speaking performances. I think that is just about everything. This was awesome and informative. Thank you all so much. And Ben and Gail, I couldn't be more proud of the both of you. Way to go and way to represent us both. Cynthia, I'll turn it back over to you.
Thank you very much, Drew, for such an amazing closing remark. So before we finish off, you could comment down how you all found the debate, the audience, the debaters, the people who are watching us on YouTube. Don't forget to leave a comment on how you found the event. And thank you so much for making time for this event and coming and tuning in and actually contributing to the conversation. Thank you, the debate team at Marian. You guys were amazing today, and we can't wait until our next debate in December. So we're going to have another debate in December, and we can't wait to have you guys again. Don't forget to follow us on social media, on Facebook, Instagram, when they get back on, and Twitter. Twitter is currently active, so don't forget to follow us on Twitter. I'll leave the links in the comment, and for those that are watching right now, on Instagram it's at iDebateRwanda1, on Twitter it's iDebate12, and on Facebook you just type in iDebateRwanda and you'll find us. And you can also be kept up on how our work is going. So to close off, I hope you all have a wonderful day, rest of the day, and for the people in Rwanda, I hope you all have a wonderful evening. Until we meet again, have a great day and afternoon. Thank you.